Hi, my name is Dr. Kate Antonetti. I am so thrilled that you have joined us for Design for Birth, and I'm really sorry I can't be with you. But I hope that this recording meets you at a time where you are ready to learn and ready to take on this information, whether you are watching this after your class or maybe before your class has started, or maybe you are watching this live at the class. It is my absolute honor to be able to introduce you to Ingrid and to the knowledge and information and wisdom that you are about to learn from her. So, why birth matters. This is like truly the most important thing to us in our office is that every family, every pregnant woman that comes through our office has a positive birth experience. And when a mother has a positive birth experience, it prepares and sets the stage for her physiology, her body, and her mind, her mental health as well, to have optimal connection with baby. So, this is why we are so passionate about you getting the information that you're getting today with Ingrid and getting almost like being prepared for what's to come also. And that's my job here to share with you all the ways in which we've witnessed families. I've been in practice for over a decade now, walking alongside families through their parenthood journey. And my job is to help to show you and shine a light on all the ways in which as new parents, you might not see something coming. And my job is to shine a light on that so you can see a possible obstacle and dodge it. And you'll see what I mean as we move forward. But we're so glad you're here and we're so excited for you to have this information to put in your toolbox so you can increase the likelihood of you having a beautiful birth experience. So Ingrid is the most humble person I know. So it is really important to me that I tell you just how lucky you are to have her teaching you today. Ingrid she's a labor and delivery nurse of over 40 years of experience. She is a DONA certified birth doula. She is a certified birth educator through Spinning Babies as well. So you are getting 40 years of labor and delivery experience matched with all the knowledge and the wisdom from her doula training as well as the spinning baby training, all brought into one package. You literally couldn't have a better teacher. So we are so grateful that Ingrid is taking the time and blessing us with her presence. And I hope you will be open and receptive and just all ears to what she has to say, because she has the perfect combination of experience and knowledge and so much love and passion for this work. So the way we birth matters, and the process of our birth matters, and the process of a positive birth experience, like I mentioned before, it sets mom's physiology and baby's physiology up for success with breastfeeding, with development, with connection, with attachment. And these things are not just in the short term, but a positive birth experience also impacts the long-term health and well-being of both mother and baby, and honestly, the entire family unit. So let's just start with where it all begins, right? In your pregnant body. As chiropractors and in Spinning Babies, we share the value of balancing mother's body, because chiropractic and Spinning Babies both know that when a mother's body is balanced, she is the portal, she is the passageway for baby to come into this earth. And when mom's body is balanced, meaning we have unwound imbalances, rotations, and tension patterns in her body through body work, chiropractic, massage, through all of the body work practices, we know that a mother going into her pregnancy and birth experience in alignment and in balance, she has less pain, she has a more enjoyable pregnancy, and she has a more easy to travel path for baby to come into this earth. So the signs of body imbalance in pregnancy are actually quite obvious, I think, but maybe I'm biased. Back pain, pelvic pain, if you're having any type of pain in your pelvis, your hips, your glutes, your back, your pelvic floor. If you're having neck pain, heartburn is a very common sign of imbalance. Hip pain, all of these things can be corrected with gentle chiropractic adjustments. In our profession, to be prenatal certified, we are certified through the ICPA, which is a governing body, a certifying body. And to be prenatal certified, we get trained in a technique called Webster technique. And Webster technique's focus is bringing balance to the pelvis and the spine so that, again, mom's body can be in balance so she can have the appropriate tone for an optimal pregnancy and birth. What I'm about to show you here is a video, and I'm really hoping it works, but it's not going to. So Heather, go ahead and pause and play the link that I've emailed you. So it's easy to miss something that you're not looking for, right? And so whether or not you got the 13 passes or not, you weren't looking for the moonwalking bear. And it literally moonwalked right through the whole thing. So what the moonwalking bear is in terms of our children's health and well-being, if we take a 10,000 foot view with the current conditions and the current health statistics of our children, it is not anything that can be argued. Our children are really struggling with chronic disease, neurological disorders. We are seeing the highest numbers in stress-related conditions in our children, more record levels that we've never seen before. No other generation has ever presented with such severe health challenges. And what the moonwalking bear is actually can be traced all the way back to birth stress. And birth, yes, we are so excited for parents to have a beautiful birth experience, but the main reason we have that excitement is we know that when a baby is born with minimal and ideally no interventions, and in a way that the parents and are prepared and educated and they have support and like in the best possible conditions, then we know that birth stress is a whole lot less likely. And what this stress does is it wires into our baby's nervous system, and that stress gets stuck almost like in their spine. And that's where chiropractic comes in. That's where pediatric chiropractic comes in. Our term in our profession is subluxation, and it literally means just stress stuck in the spine. And what that looks like is, and how it relates to birth injury, is the impact of stress, especially when there's interventions like forceps, a vacuum, or an emergency C-section where a baby is quickly pulled out of mother's gravity-free womb space into a world of gravity. We see this level of birth injury in the upper neck, the occiput upper cervical spine. And that has a connection to the brainstem. And that connection to the brainstem also impacts the cranial nerves. And that connection to the brainstem, the cranial nerves, and the central nervous system is so huge. When a baby has any type of birth stress, any type of stress that is stuck in their spine from a difficult birth experience, we see challenges in early on. It looks like colic. It looks like latching issues. It looks like tongue ties or tension in their tongue and jaw. It looks like baby is having gas or tummy pains when they're trying to nurse. All these things look like diagnoses of colic or reflux or just a baby that's not easy. But really what it is there's stress stuck in their sweet little spine from a really difficult entry into this world. So where pediatric chiropractic comes in is we unwind that stress. So we can't go back and undo our birth experience. And the whole purpose of this class is that you don't have to, that you don't even have to worry about this conversation. We want you to have the most beautiful, positive birth experience with no interventions and just nothing but an empowering and intervention-free experience. But what I'm letting you know is if there is any intervention, if there is any stress, or maybe there is no intervention in birth, but baby is stuck in your pelvic floor for a long time, or they just have a hard time navigating their exit pathway, we so often see this term subluxation in the upper cervical spine, which then impacts our baby's development and their ability to eat, sleep, and poop. And that's really the big thing. Another thing when we talk about pediatric chiropractic is even in the most beautiful birth experiences, we know that 65% of neurological development, so that's development of the brain and the nervous system, occurs in in the child's first year of life. So this is why we are so passionate about removing any undue stress on their sweet little nervous systems so that they can develop optimally and free of any interference to their development. And that is where we come in. So the thing that breaks my heart is when parents say in retrospect, like, why didn't anyone tell me that when my baby wasn't able to nurse, that chiropractic could help? Why didn't anyone tell me that my colicky baby and all that gas pain or their reflux or their gut issues and constipation, why didn't anyone tell me that chiropractic could help? For the families that are having sleep struggles and the little ones that are having torticollis, which is tension in their neck, which doesn't allow them to have full range of motion in their neck, and therefore they lay more to one side than the other, so their their cranium starts to mold in a imbalanced way, and that's what plagiocephaly is. It's a flat spot in the head. So when these parents come to us and they're like, why didn't anyone tell me? That's what breaks my heart, and that's why I'm sharing this with you now. I hope you don't need us, but what you certainly will need if you find yourself with latching difficulties, colic, gas pain in your baby, reflux, just difficulties with anything under the umbrella of eating, sleeping, and pooping, that is a sign of stress within the nervous system. That is a sign of your baby's sympathetic nervous system being too dominant and their parasympathetic nervous system needing to be strengthened. What pediatric chiropractic does so well is it turns up the volume of the parasympathetic response, and it turns down the tone and the intensity of the sympathetic fight or flight response. So when we bring that balance into baby's body can experience ease for the first time. They can relax into their sweet little body, and that allows more mobility of the jaw, the upper neck. Tension is released from their tongue. We see so much improvement in reflux, in tummy pain when we bring ease into their body through gentle pediatric chiropractic. I'm going to just go back to this slide because honestly, this picture says it all. All of our pediatric adjustments look like baby massage. It really looks like we're not doing anything. So if you're thinking that pediatric chiropractors are doing anything aggressive to a baby's spine, please know that is not the case. We are trained to hold gentle contact at tension points and wait and feel as we hold that pressure point until everything relaxes. Our babies' spines are so different from adult spines, and they honestly melt into our hands when they get this stress unwound out of their spine. So you can see here this little one smiling. Most of our babies sleep through our adjustments. And most of all, after our adjustments, we always see a huge increase in eating, sleeping, and pooping. Another thing that I want to bring your awareness to is further down the pathway getting into toddlerhood. Little toddlers getting diagnosed with multiple ear infections is so often a sign of an unresolved stress point in their upper cervical spine, which has been impacting their TMJ, their jaw joint, and impacting the way the eustachian tube between their upper neck and their jaw. That drainage point, that plumbing point, is between those two very important joints of development in our babies. And if either one of these joints, upper cervical spine or TMJ, are not moving ideally, the plumbing, the drain for the middle ear is not going to drain optimally. So if your little one gets ear infections, please take them to a chiropractor. This helps to restore normal motion of the joints that surround the eustachian tube and the inner ear and helps open up that plumbing system and allowing it to drain. It is incredible if we can just reduce the amount of antibiotic exposure that our babies have. And the most common reason little ones are prescribed antibiotics is for ear infections. So please know that chiropractic is a very evidence-based, science-backed approach to ear infections, and it's worth it. Modern medicine goes in and the antibiotics help to address the bacteria, but we have to address the plumbing or the issue is not going to resolve. And that's when surgery for tubes is literally making a new exit point, a new plumbing point for these kiddos. So we just think it's definitely worth addressing what we naturally are working with and help release and relieve that. So if ear infections go on long term, if this dysfunction of the upper cervical and the TMJ continue on, then our kiddos are going to have sinus and breathing and airway dysfunction. So that looks like them breathing through their mouth the majority of the time, which then that leads to their tonsils and adenoids getting inflamed, because we're not meant to breathe through our mouth, we're meant to breathe through our nose. So this is when tonsils and adenoids get inflamed. They might need to get those removed as well, along with tubes, and all those things could be avoided with gentle pediatric chiropractic. If our kiddos are getting sick all the time, this plays into all that as well, especially when we talk about the vagus nerve. The vagus nerve is a cranial nerve that exits out of the brain and through the upper cervical spine. And if there is stress stuck in the upper cervical spine, it limits the tone of the vagus nerve's ability to feed into both the immune function as well as gut function. And the vagus nerve is so wired into our immune response and our gut, and the gut and the immune response are wired together as well. So when we have any issue in the upper cervical spine, when our kiddos have stress stuck up there, it dims the vagus nerve's ability to do what it does best, which is regulate the immune response, as well as regulate and upregulate the gut function as well. So when we do gentle adjustments to this area, we see gut improvements, we see immune system improvements. And this, at the end of the day, our ultimate goal is just to keep our kids as healthy as possible and to limit the amount of antibiotics that they are exposed to. Antibiotics absolutely have a place in time, but we are dealing with an epidemic of antibiotic resistance. So if you can avoid the antibiotics in the areas of ear infections, then they can be present in areas like strep throat. So that is our whole goal is just to let you know that there are alternatives to what you may hear in like the mainstream, right? And chiropractic has been around for over 100 years, and we have been showing this in our case studies and our research as well. In postpartum, it just turns into a lot of time feeding your babies and holding your babies and looking down at your babies. So we see a lot of neck and upper back tension in our postpartum moms. We also see a lot of low back discomfort because our core isn't quite online yet. So chiropractic can help in all these areas just to help improve your ability to feel good in your body. And that's also where Mama Core comes in. This is a passion project that I am just so deeply connected to. And this is where we bring community connection and education together for mothers. We've just recently created an online course because in early motherhood, you definitely feel like you don't have time to leave your baby. And oftentimes it's just not feasible to leave your home to go to a class. So we have both in person in a classroom setting and an at-home program, which I would just encourage you to, for the first 3 months postpartum, mamas, just rest and co-regulate with your baby, go for gentle walks and just take it super easy. But when you are ready to start to go through some functional movement and start to build strength and awareness again to your core and pelvic floor, Mama Core is the perfect entry point for you. And so we recommend starting at about that 12-week point. So thank you so much for being here. Congratulations on setting yourself up for success. And if you have any questions, you can always reach out to us at our office. We are just so grateful for you having the curiosity and the commitment to doing whatever it takes to Give your baby the best start to life possible. Have a wonderful, wonderful remainder of your pregnancy, and we hope that you have nothing but joy on the other side. Bye.